Now, each leukemia has got its own character, and therefore response to treatment varies from leukemia and from patient to patient. Now, for example, if you take chronic myeloid leukemia, for example, about 15, 20 years ago, the only treatment for a chronic myeloid leukemia was a bone marrow transplant. But with medical innovations, that is now treated by sitting at home and taking a tablet. So that is the power of medical inventions. And these patients, we can almost say that a proportion can be cured of their disease. Chronic lymphocytic leukemia, on the other hand, tends to be more chronic. So it tends to go into sort of remission. When we say remission, which means they clear of the disease, and then it can come back, or we can keep it under control for a long time. So we are treating it, but although we may not say that we have cured it, but patients are well with it and they go about their normal lives. Coming to acute leukemias. Now, for acute leukemias, the treatment is a little bit more intense. Whereas the chronic leukemias, we can manage most of them, we can manage them in our office as an outpatient. The acute leukemias need quite intensive chemotherapy to be admitted in the hospital. Having said that, most of these patients, I would say upwards of 80 to 90%, would respond quite well to the induction chemotherapy and go into remission, which means they are free of disease. The only curative option for acute leukemias is actually a bone marrow transplant, although not all of them require it. There are also innovations underway to target certain mutations in the diseases, which gives us better outcomes. There are antibodies which can target these. There are newer therapies like CAR T cell therapy, which is used quite extensively abroad, and now there are trials in India using this treatment with excellent results. And bone marrow transplant has always been a standard of care for some of these patients with leukemia whom we can say we can actually cure. So there's, depending upon the type of leukemia, whether it's chronic or acute, whether it's myeloid or lymphoid, depending on the age, whether it is presenting for the first time, whether it's relapse disease, each of these scenarios will require a different assessment and a different therapy. But there is treatment for each one of those, and in some instances, they are curative as well.